Hi there, everybody. It's Dr. Soloway. It's Saturday. You can see I have sunburn because it was sunny today, but if you look now, you'll see the skies here in the great state of New Jersey are black. I have a special guest with me, a medical student, Alexandra Morgan, and she's top-notch. So, trying to answer some questions. I apologize, I don't know your names or handle numbers because there were so many questions, but it was under the PMR topic. So, okay, person asks me this morning, and oh, you know what? Before I go into her story, let me make it clear. A lot of the things that are happening in medicine with the government, okay, so Medicare. And by the way, this is a reason you don't want Medicare for all. In fact, you don't want any one health insurance for all, because then they make all the rules, and if you think your doctor has limited choices now, your doctor's going to have no choices. You're going to be doing whatever the cheapest thing available is, and that is happening. Now, we'll get back to that after. So the woman writes in today that she's got, I think it was 3 years of pain while walking, but now she has some other pain. And I guess the question is, well, does she have PMR or not? So there has to be the suspicion for inflammatory joint pain, which again, morning stiffness more than 30, 40, 50 minutes, waking up feeling like a train hit you, possibly headaches, possible trouble chewing because of jaw pain, tongue pain, soreness in the proximal girdles, which is the neck and shoulders, the hip and butt, the thighs. Can you get knee pain with any inflammatory disease? The answer is of course. So you can have a gout attack in your knee, you can have chronic gout in your knee, you can have Lyme arthritis involving your knee, you can have rheumatoid arthritis involving one or both knees, you can have psoriatic arthritis, you can have ankylosing spondylitis. So any condition, anything, Behçet's, relapsing polychondritis, vasculitis of any type, ANCA, non-ANCA, small vessel, large vessel, medium vessel, Erdheim-Chester, my favorite rarity. All these diseases can give knee arthritis, but what's coming up now is, gee doc, for 3 years I can't walk because my knees hurt. Okay, well, it could be inflammatory. In a middle-aged woman, and I don't know how old this woman is, if she's over 50 or 60, high chance that she might have calcium pyrophosphate deposition disease, and when it flares, it would be known as pseudo-gout, and if it doesn't flare, but it's in the wrist or MCPs, then it would be known as pseudo-RA, and if it mimics OA, because of calcium pyrophosphate deposition, you can have pseudo-OA. So, after discussing this now, does this person have OA? Well, what's her history? Does she wake up with stiffness in the morning and the stiffness is less than 15 or 20 minutes or less than 30 minutes? Is it progressively getting worse? Is it the only joint involved? There's no morning stiffness in the hands or wrist or feet or toes or ankles, just the knees. Does there become the gelling phenomena, which is when you sit for an hour and then you stand up and you can't get moving for about 15 minutes? So sure, you can have OA of the knees progressively getting worse for 3 years with or without calcium pyrophosphate, but then you want to add in, well, gosh, how do I know if I have an inflammatory condition or not? So this is clinical judgment. You go to a very experienced rheumatologist, you try to find the best you can, and hopefully they ask the right questions, such as, gee, does anything else hurt? Are you stiff in the morning? And so on and so forth. Sometimes it comes down to trial and error. You do all the blood, and sometimes it's normal, and sometimes it's abnormal. And I'll tell you time and time again, we don't treat blood tests. And anyone who's treating their patients based on the ADVISE panel or AVISE panel or the other one that's like it, I can't even think of the name, Vector something or other, these two tests, well, they're not bad tests. However, we already have rheumatoid factor and CCP. We already have SED rate and CRP. We don't need an expensive panel of 200 tests, half of which are not clinically appropriate anymore. We just don't need them. So anyone managing their patient based on fluctuations in blood test, I would politically correctly say that they're disingenuous and feckless. I don't want to use dirty words on TV. So the other thing, somebody asked me a question about why don't we check the anti-chromatin antibody, and it's so specific and this, that, and the other thing. So the double-stranded DNA and the Smith antibody are 95% each specific for lupus. The ANA is almost 100% sensitive, which means that the ANA is seen everywhere, But to have lupus, you need to have a positive ANA, even if it's on one occasion, because it does come and go, and I really can't give you a great answer as to why it comes and goes in 2 seconds. We use the double-stranded DNA in the complements to predict flares. Typically, we're talking about lower complements, tell you if there's a kidney flare coming on, and double-stranded DNA elevations often mean the person is sick with lupus features. There's another tidbit that I think you should know. If your C-reactive protein is highly disproportionate to your SED rate, and by the way, I don't follow these tests in anybody, but if you have a situation where the CRP is very high, the SED rate is normal, and you have a lupus patient, it's more likely that that high CRP would tell you to search for an infection, okay? By the way, still in the mobile office, bad weather, but I love you guys, and I have to, get this info out to you. I'm actually passing an abandoned car. And don't forget, if you're bored tonight, for God's sakes, watch Stripes, all right? Don't forget, watch Stripes. The Jeopardy thing, that's over. That guy lost, whoever he was. Anyway, okay, back to reality here. I only have a few minutes before I pick up dinner for my parents. I'm heading to the diner. By the way, the diner has the Dr. Soloway menu with healthy food. They got chicken cutlet parmesan without the breading. They've got fish without the oil. Healthy menu at the Malaga Diner. You should go there. It's good. Also, Pickwickian. Excellent. The Pickwickian has the best, what do you call it? Barbecue food. The owner, his name is George, a good friend of mine. It's another great restaurant. And if you're in Wildwood, make sure you eat at the Hotspot for pizza, and also make sure you go to the Vegas Diner. Best fresh shrimp and scallops I've ever had in my life. They could put a New York fish house out of business. All right, so there's 3 restaurant picks. If you're in Wildwood, or if you're in Malaga or near Vineland, or if you're in Richland, I think it's called. It's down Route 40. Go there. Tell them you heard about them on the Dr. Soloway YouTube show, and they'll give you a glass of water for free, and everything else is on you. But they have great chicken and pulled pork. Okay, so I'm lost. So chromatin antibody. I've never ordered one in my entire career. 31 years, I never ordered chromatin. So what does that tell you? This test is worthless. It's, in fact, you can only order it if you get one of those so-called panels, and the panel that is doing that is through one of the 2 major labs. In fact, in my building, in my complex, we have a Quest lab, okay? They've been there almost 20 years. They don't do the chromatin antibody. It's useless standing on its own. It's useless in clinical context. When I've received records from other rheumatologists, I see that people who are stuck using, for insurance reasons, maybe another lab, or because they don't know any better, they do order this test. But I would not put any stock in that test for any reason whatsoever. None. I've gone through more than I thought. I hope I was able to answer some of the questions that came up over the past 3 days. And regarding the question about how do I exercise if I'm in so much pain? So, I feel for you. The government no longer lets us give viscosupplementation unless you do 12 sessions of physical therapy. Now, some of the orthopedic surgeons are doing it anyway, but they don't have the volume I have, so they're not getting audited to the degree I'm getting audited. So again, another reason you don't want socialized healthcare, because boy, you're not going to have any choices. Nothing's going to be available to you. I mean that. I mean that sincerely. You're going to go to a doctor and they're going to say the bill's $200. You're going to submit it to Medicare and they're going to give you back $75, and it's either that or don't see a doctor. And don't forget, emergency rooms are for emergencies. So if they don't know what's wrong with you, it's not their fault, but they're trained to recognize and treat heart attack, GI bleed, asthma attack, things like that. They're not trained to manage arthritic conditions. It's just not their thing. Just like, I gave up heart attacks and strokes 31 years ago. There was one more thing I wanted to add in. I may have forgotten it. Oh, the exercise. So the Medicare and all these insurances, they say, oh, you must exercise, you must go to physical therapy. And of course, I understand there's people that can't go to therapy. They're in too much pain. So for those people, if you have access to a swimming pool, something simple like walking inside the shallow end of the pool, even with a life preserver, you don't even have to know how to swim. You just have to make it in the pool, that's all. Just moving, it'll help you. Or go sit in a hot tub. And if you don't have a hot tub, go in the bathtub. And make the water, warm. Put bubbles or oatmeal or whatever. It's good for your skin. It feels good. And I'm parked at the diner now, so Mom and Dad can eat tonight. So I get it. You can't go to therapy. You can't use machines. You can't walk too much. By the way, there's a treadmill called Alter G. I highly recommend that you find a physical therapy place that has an Alter G. It's a $50,000 treadmill, but a 200-pound person is only 40 pounds when they distract the amount of gravity that can be taken off. So you're able to run and walk without bearing any weight, meaning you can use the muscles that hurt, the back, the hips, the thighs, the knees. You can use all these things. You can rehabilitate sprained ankles. You can rehabilitate bad knees, ACL, osteoarthritis, meniscal injuries. Okay, we passed 10 minutes. I gave you a lot of information. You're going to have to watch this one a few times, and have a good night. And my co-host on the show, Alex Morgan, she's being very nasty right now. She's trying to grab the phone from me. So I'm hanging up before she embarrasses me. She's laughing.
Dad's wonderful. Good night.
Yeah, okay, so I'm wonderful. Don't forget. There she is. Smile for the camera.
Hi, Dad.
Yeah. That's all she's got to say. She's going to be a doctor, and all she could say is, "Hi, Dad." All right. Take care.